Hello everyone, you are all welcome to lecture number 1286, and today's topic is pleural effusion, commonly call it as water on lungs or water in lung or water around the lung. Means there is excess water around your lung. That is the meaning of peripheral. This one, that is pleural effusion. Pleural is a space around the lung. It is lining. I will show you. And in that lining, due to some reason, some health condition, or even because of cold and some bacterial viral infection, around that area, within that lining, the water fluid is restored. And once excess fluid is stored in that area, you will get lot of symptoms like mild chest pain, and also in breathing you will not be comfortable, nose blockage, and lot of problems. And as you know, that the once we are aged, in the age group of 70 or above, then there are mainly three causes of health emergency or death, we can say. First is, that is cardiac problem, heart attack. Second is, that is cancer. And third is pneumonic condition, pneumonia. And all these conditions, once we are getting, there is always chance of getting fluid around the lung, that is called water on the lung, that is pleural effusion. And once the cold season, December, January starts, this condition of getting water on the lung becomes more and more. And for this, the advice for senior citizen is that they should have regular this flu vaccination, and also vaccination against pneumonic condition, pneumonia, because once you are vaccinated, your immune system is boosted, is strong, and it can fight very well. Otherwise, once this lung water, that is water on lungs, can cause pneumonic condition, you may get bacterial infection. But in the beginning, once such symptom is there, that where taking deep breath, you feel pain in chest, you feel pain, and always you feel heavy, fatigue, weakness. So all these conditions are related to your water on lung, that's this pleural effusion. And sometimes the doctors, they are confused with that because they are not yet having bacterial infection of pneumonia. But once this water on lungs becomes chronic, that is pleural effusion in that lining, then pneumonic condition may come. So that's why we have to be very, very careful, especially once we are crossing the age of 60 and 70. I have seen 90% cases, first they suffer from water on lungs, that is pleural effusion. So I am showing you the image. So you can see a very clear image of lung, both lobes, and there is band around the lung, and in between lung and band there is very thin, we can say, space of lining, and that is called pleura, and that is where we call it pleural space. And this pleural space, once it is filled with water, then our lung will be under pressure and you will feel suffocated. This is very clear magnifying image of pleural effusion. The lung is there and enough space is shown between the lung and that outer lining, and that is containing lot of water on the outer side of the lung. That is called pleural effusion, and it is serious issue, and you have to drain it out. If this condition happens before you are reaching to chronic condition where pneumonic condition and some other factor is coming, and also once you are having pleural effusion means water on the lungs, means it is indication that maybe your heart is becoming weak and also your kidney is not properly functioning. That's why you are having excess fluid around your lung in pleural space. Here it is very clearly shown that pleural space, pleural lining, and where if water is filled, your lung will be under tremendous pressure and your breathing, deep breath, all will not be comfortable. You will be having always chest pain, fatigue, weakness, and even fever. So this is very serious issue, especially it happens slowly in the month of cold season like December, January, February. So you have to protect your chest, your lung, and once you feel such type of condition, please contact your doctor. So here I have given all those conditions, symptoms, causes, prevention, and also in chronic condition, losing the respiratory system and even dying out of pneumonia. So it's a very serious thing, but in the beginning, if we have properly diagnosed and treated, there is no problem. So number one, pleural effusion, also known as water on the lungs. Commonly people say water on the lungs or water around the lung, is a medical condition characterized by accumulation of water, excess water fluid in the pleural space of lining. That you have already seen the images of all those pleural lining around the lung space, which is the area between the lungs and chest cavity. Number two, pleural effusion can stem from simple cold. Can stem from a simple cold in full cold, and the chronic cold is alarming when you start getting difficulty in breathing. It starts from simple cold and then it becomes chronic, and where you feel suffocated or pain in deep breathing or full breathings, and the mild pain in lower chest. When you get deep breaths and coughing hard to tolerate. In the beginning, there is always confusion. Once you are going to doctor, that they suspect it is pneumonia, but actually in the beginning it is not pneumonia. It is that condition is mainly related to some allergy or some other health issues. Like if suppose your heart or kidney, they are in weak or they are in trouble, you may get this pleural effusion. But immediately they will start that is antibiotics to treat pneumonia. But that is the doctor, they have to check thoroughly for that condition, pneumonia, when you go to doctor. Water on the lungs is common in senior citizens. Once you are above the age of 60, 70, you are going to suffer from these three type of health conditions: pneumonic condition, cancer, and heart failure. That is called heart attack. And it is very common to have water on the lungs. That is called pleural effusion condition. And there are some causes. So I have given here the causes of pleural effusion. First, infection like tuberculosis and cancer, and also finally pneumonia. Number two, chest pain. That is, and also Number 2, that is heart failure and kidney failure. Once your heart is very weak towards failure or kidney towards failure, then again you will suffer from water on your lungs. That is called pleural effusion. That shows the symptom. And also if you are suffering from autoimmune disease, that is called rheumatoid arthritis. In that condition, again there is chance of getting pleural effusion, that is water on the lungs. Number 4, symptoms of pleural effusion, that is water on the lungs. The symptoms are: number 1, shortness of breath, cough, and finally dry cough. Number 2, chest pain with coughing, worst in deep breathings, fatigue and feeling weak, and also feeling tired. There will be weight loss, and also sometimes you will get fever. So number 5, treatment. For treatment, first we have to go for chest x-ray to get the clear image of the chest. Number 2, computed tomography. Computer tomography is CT scan. Computer can provide more detailed image, and you can say zoom images of your chest. Then number 3, ultrasound, means using sound wave to get your image of this space to collect fluid from for the analysis purpose. Then other one is, that is number 4, thoracentesis. It involves the inserting of the needle, and then you will get the fluid for other tests like biopsy and some other biochemical abnormalities. So these are all this, and this. The 5th one is, that is pleurodesis. Pleurodesis means it involves injecting medicine inside that space, so that in future such fluid, excess fluid collection will not be there around the lung. It will be in, that is pleural space. Then the number 6 is medication. In medication, usually the drugs like diuretic and antibiotic is given. And then prevention. What are the preventive measures? Number 1, practice good hygiene. Number 2, get vaccinated against malaria, not malaria, this flu and pneumonia. Because these 2 vaccines, please, if you are above 50, consult your doctor. Every 4 or 5 years time, you get this vaccine against pneumonia, and also every 6 months or every 3 months, you get flu vaccine. That flu vaccine will protect drastically from this pleural effusion, means getting liquid filled around your lung. It's very important. You consult your doctor, discuss this issue, and many people in Western countries, they are following this practice. In our countries like India, in Asian countries, in Africa, they are not following this practice that they should get checked, and automatically after the age of 55 or 60, first vaccination they should take against pneumonia, and then every 6 months they should take flu vaccine. In America, the practice is like that whenever there is flu season in December, January, after every 3 months or 6 months, it is a routine work. They will go and get vaccinated against flu. Then complications. In chronic condition, you are going to face first complication, that is, you will lose your respiratory system. Your respiratory system will die. So the first is, that is in chronic condition, respiratory failure. Number 2, infection very frequently will increase, and the risk of getting frequent infection. And finally, if it is not treated, it is pneumonic condition, you will get pneumonia. not as a physician, but as a professor of medicinal chemistry, understanding all the condition on cellular basis, protein basis. Please follow this recommendation. Those who are above 50, if you have not got the vaccine against pneumonia, you are not vaccinated, please get vaccinated. And secondly, you make a routine that every 6 months you take the vaccine against flu. With this, I will stop. Thank you very much for watching the lecture.